congenital talaga, baby pa lang. Yung mga bandang September, meron ng umuumbok-umbok dito sa leeg niya. Hindi ko talagang iniisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPAR partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates. So it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARs, which is touted as one of the best natural ways of solving serious health problems.
PPARs stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARs, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARs is made out of a special strain of these types of microalgae. It is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARs is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age, na 8 years old, he believed that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really, like Simply Nature, that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
So the doctor took out his video stroboscopy and he looked at it, and then when he checked it, he said, "Oh, seems like it's gone. He pulled out the camera and checked it again. And he was saying, I think it's gone. The cyst is gone. Your vocal cords are looking great. What did you do? Then he pulled out again and checked it again. He sat down and said, it's gone. Hi, my name is Nesta Vicencio and I'm 32 years old. I'm an insurance agent, so I'm in sales, so you could think of I've been talking a lot, and I regularly sing because of ministry. So I sing on Sundays, so I use my voice a lot. Starting January 27, I started losing my voice, and then the hoarseness remained for more than 2 weeks. And this started bothering me, like what's going on with my voice? It's taking too much time. 2 weeks and a few days, I decided to see my ENT doctor, and he diagnosed me with chronic laryngitis. And then, for the first meeting, he asked me to take steroids. The point is to remove inflammation. So he's saying that probably I have throat inflammation because of voice use. So fast forward to taking the steroids for a week. I've been on voice rest, and whenever I test my voice, the hoarseness is not going away. I'm still strained. Whenever I try to talk, it gives me pain on my neck up to my head because it feels like I'm using head tone every time I try to produce sound. So I went to a different hospital, and a different doctor did the video stroboscopy to see what's going on with my voice box, my vocal cords. And when he did that, I already felt nervous about what I'm seeing on screen. And then when he started saying that you have a vocal cyst and the only way for this is to undergo surgery, tears started falling down my face and I just couldn't help it. As someone who uses my voice every day in everything that I do, in my work, in my ministry, talking, singing, it's like too much for me to take. I asked for the recovery and the doctor said, for now, you need to go on voice rest to remove the inflammation. Take the steroids to remove the inflammation. Once you're cleared, then you can go for surgery. And that's the only way. I said, so if I will have vocal surgery, will it affect my voice? Then they said, you will be able to speak again. But as for your singing voice, we have no assurance for what will come out. Honestly, after the 5 doctors, it felt like, okay, there's no other way but surgery. And then one day, our good friends, Sister Jazz and Pastor Shyan, they introduced me to PPAR's extract. This product helps with cysts, tumors, and it helps, and it's all natural. So for me, what would I lose by taking something natural and non-invasive and something that's recommended by people I trust, people I love? So I said yes to them because I'm at the state where I really want another option other than surgery. So at first, they recommended me to take the PPAR's extract liquid, which is a liquid form of PPAR's, and they asked me to take it for 3 days. Then after that, they gave me PPAR's extract powder. And then after 2 days or after 2 vials of PPAR's extract liquid, there was a morning that I forgot that I'm on voice rest because I just woke up. So I just woke up and greeted my husband, and my husband was like, "Why are you talking? You're supposed to be on voice rest." And we were both like shocked that, oh, I'm not supposed to talk. And then he said after, "But baby, your voice sounds better. It sounds normal." So I tested my voice again and said another line. And we looked at each other and said, "It sounds normal." And this time, it's just on my second vial. After 5 days, so 3 days vial for the first 3 days, and then on the 5th day, on the 4th and 5th, I'm already taking the powder of PPAR extract powder. So I got so excited and curious, so I went to see my doctor. I will never forget this moment because when I entered the room, my doctor said, "So what's your plan with your life? When are you going to do your surgery? And I was like, oh, doc, I'm done with taking the steroids. I'm done with my voice rest. I've been on voice rest, strictly doing it. And then when I was talking, my doctor said, is that your normal voice? And then I told him, yeah, it is my normal voice. Does it mean I'm okay? And then he said, well, of course, probably because of the steroids, which I didn't tell him. Before taking PPARs, I decided to throw away my remaining steroid tablets because I've read about it. It's not really good. So on my own, I decided to throw it away and start taking PPARs. And then he said, oh, probably it's just the steroids because the inflammation is gone. That's why you're back on your normal voice. I said, no, the cyst will not go away on its own. So it's probably the voice rest. So come, let us check it. So the doctor took out his video stroboscopy and he looked at it. And then when he checked it, he said, oh, seems like it's gone. He pulled out the camera and checked it again. And he was saying, I think it's gone. The cyst is gone. Your vocal cords are looking great. What did you do? Then he pulled out again and checked it again. And then that's through the mouth. And then he said, wait, one more time. I'll just try it through the nose. So the doctor, who was supposed to finish our appointment, said, oh, one last time. I just want to see it one last time. So he tried it through the nose and checked through the nose. He said, it's really gone. Oh, can you tell me everything that you did? I need to document this. Is it okay if I write a report about your condition? Because the cyst is gone. And then he said, oh, maybe I will see you in 2 months. Just come for a checkup. Let's see what will happen. But you can continue with voice rest. Don't get too excited. So I'm really, really grateful that I got introduced to PPARs extract, the liquid and the powder.
So Simply Nature PPARs actually have very strong anti-inflammatory properties and anti-inflammatory nutrients. So with Nesta's case, being her voice box is inflamed, no? Which eventually led to her vocal cords developing cysts. With less inflammation inside Nesta's voice box, it eventually led to the resolution of her vocal cord cyst.
When you get diagnosed with this, and the doctor would say that the only option is surgery, of course, it's good to listen to your doctor, but it will not harm you to try PPARs liquid extract and even the PPARs extract powder so that you can get better.
Where will you go?
Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distribution is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international
There you go. Hello and good evening, everyone. I'm Sheila, and you are watching another episode of Simply Nature Webinar,
Find out how this international
your long-time running healthcare awareness webinar here in social media. Tonight's topic is entitled Beating Cervical Cancer Treatment Strategy Guide. You know, cervical cancer ranks as the second most frequent cancer among women here in the Philippines, next to breast cancer. And this is for ages between 15 and 44 years old. But there is good news because, according to studies, cervical cancer is also one of the most preventable and successfully treated forms of cancer. To start off our discussion about our topic for tonight and to enlighten us how immunotherapy helps in treating cervical cancer, I'd like to call on our PPARs expert fresh from Singapore and the CEO of Simply Nature, Mr. Sean Lim. Good evening, Sir Sean.
Good evening, Sheila. So glad to be back here in Philippines to go live with everyone. I was here with everyone last Thursday, I think. But yeah, I was. But I went to Singapore over the weekend, and I'm back here. I'm back here. It's so good to be back here. And tonight we have Dr. Johnson joining us again. So just in a few more moments, there will be a Ask Me Anything segment for those who are new to our program. So again, welcome everybody. We are so excited. Dr. Johnson's going to do a short, very brief, very insightful discussion. It will be a case study. So that will be very interesting for everyone to learn about cervical cancer. So that will be about 10 minutes long, and then we will be right back to answer your questions. So get ready with your questions. It's the Ask Me Anything segment, so you can ask anything. Of course, tonight's topic is cervical cancer, but it's not limited to that. So without further ado, Sheila, why don't we welcome Dr. Johnson?
Thank you, sir. Welcome back once again, and I hope that you had a great time in Singapore. Okay, and you know what? Just before we introduce our Dr. Johnson, you know what? This webinar, sir, is actually an early treat to all the ladies out there, most especially our moms, because this month is also in celebration of our Mother's Day. So in advance, and our advance greeting to all the mothers out there. Happy Mother's Day. Okay? And with so much factors that causes cervical cancer, most of the time, it is very hard to discern whether the symptoms really fall on the boundary of myoma, menopause, or ovarian cancer, or even endometrium issues. So to give us more clarity and information about cervical cancer, here is our lifestyle medicine doctor and the director of the Simply Healed Medical Group, Dr. Jansen Tankalalan. Please watch this.
Hi, this is Doc Jansen, your lifestyle medicine doctor, helping you in your recovery from cancer. So today, ang pag-uusapan natin ay kung paano gumaling sa cervical cancer. So bago natin sagutin ang tanong na yan, ano nga ba muna ang cervical cancer? So ang cervical cancer ay tumor na tumubo sa cervix. At ang cervix ay located sa bandang itaas ng vagina. So ito rin ang tinatawag na kwelyo ng matres. So ano ba ang cause ng cervical cancer? Ang cause ng cervical cancer ay ang tinatawag nating human papilloma virus or HPV virus. So itong HPV virus, saan ba ito nakukuha? Nakukuha ito sa pagtatalik, especially for those na maraming sexual partners. So gaano ba ka-common ng cervical cancer sa Pilipinas? Actually, it is the second most diagnosed cancer among women. So noong 2020, merong 7,900 women na diagnosed with cervical cancer. Also, cervical cancer is ranked 4th in the number of deaths due to cancer among Filipinos. So kapag na-diagnose ka ng cervical cancer, mabubuhay ka ba? Ano ang survival rates ng cervical cancer? So the 5-year relative survival rates for cervical cancer for localized stage is 92%. For regional, 58%. For distant or metastatic, it's 18%. So makikita natin dito sa survival rates na to is kapag na-detect ang cervical cancer very early on at nagamot ito, malaki ang chance na mabuhay ka after 5 years. However, kapag napabayaan natin ito at hindi tayo nakapagpagamot agad, bumabagsak to 18% na lang ang survival after 5 years. So, paano ba ginagamot ang cervical cancer? So, ang treatment options na available sa'yo ay nakadepende kung ano ang stage ng cancer mo nang ma-diagnose ka. So, we have 4 stages of cervical cancer, which is stage 1 up until 4. Stage 1 is a tumor confined to the cervix. Stage 2 is a tumor that extends beyond the uterus but has not extended onto the lower third of the vagina or to the pelvic wall. Stage 3 is a tumor involving the lower third of the vagina and or a tumor that extends to the pelvic wall that causes hydronephrosis or yung pagbabalo ng kidney or a non-functioning kidney and or lymph nodes that is found inside the abdomen. And lastly, stage 4. This is a tumor that extends beyond the true pelvis, involves the bladder or rectum o ito yung urinary bladder o ang pantog o yung huling bahagi ng colon. And lastly, that is spreading to the distant organs katulad ng liver, lungs, bones, brain. For every stage of cervical cancer, mahahati pa ito further into Stage 1A, Stage 2A, Stage 2A, Stage 3B, etc. So for Stage 1A1 cervical cancer, ano ang treatment options na available? That would be cold knife conization. This is a fertility sparing procedure, no? So for patients who are diagnosed with cervical cancer na gusto pang mabuntis, this is the way to go, especially for early stage cervical cancer. For high-risk patients naman na na-diagnose early, no, with cervical cancer, you can actually opt for total abdominal hysterectomy with or without bilateral salpingo-oophorectomy. In other words, yung uterus pwedeng tanggalin at optional na tanggalin ang ovaries at ang fallopian tubes. So for stage 1A2, you can have your entire uterus removed together with the surrounding lymph nodes. However, kapag ang isang babae ay gusto pang mabuntis, you can opt for radical trachelectomy. So ano ba itong radical trachelectomy? So itong radical trachelectomy is removing half of the uterus or the lower half of the uterus and then attaching the rest of the cervix together with the upper part of the uterus. And lastly, you can opt for brachytherapy or internal radiation therapy. For stage 1B and stage 2A cervical cancer, you can actually have 4 options. So number 1 would be concurrent chemotherapy and radiation therapy. So ibig sabihin sabay po na ibibigay ang chemotherapy at radiation therapy para mas maging effective ang radiation therapy. Next, pwedeng radiation therapy lang. Number 3, you can actually opt for surgery, chemotherapy, with or without radiation therapy. And lastly, para dun sa mga babae na gusto pang mabuntis, you can actually opt for radical trachelectomy. For stage 2B, 3, and 4A cervical cancer, you actually have 2 options. So number 1 is concurrent chemo radiation therapy, same as before, no? And number 2, surgery to remove pelvic lymph nodes plus radiation therapy with or without chemotherapy. And number 3, targeted therapy using bevacizumab or a combination of these procedures and medications. Doc, paano naman kung tapos na ako sa treatment at later on nagkaroon ako ng recurrence? Ano naman po ang mga treatment options na pwede kong gawin? So for cervical cancer recurrence, you actually have 4 options. So number 1 is immunotherapy using pembrolizumab. Number 2, concurrent chemo radiation therapy again. Number 3, chemotherapy with targeted therapy. So ito po yung chemotherapy na cisplatin, carboplatin together with bevacizumab. And number 4, pelvic exenteration. So ano ba tong pelvic exenteration? So ang pelvic exenteration ay reserved only for patients who cannot undergo radiation therapy. At ang procedure nito ay ginagawa para tanggalin lahat ng parte ng katawan na mayroong cervical cancer. So Dok, paano yan? Mukhang ang daming side effects ng mga treatment na to, no? Especially chemotherapy, radiation therapy, ang daming side effects nito. And one of them, ang very common side effect is weakening the immune system, fatigue, no? So may mga paraan ba tayo na pwedeng gawin para ma-avoid natin ito at mabawasan ang mga side effects nito? Yes, there is, no? So one method is to exercise, no? So physical activity is actually very important kasi patients engaging in more physical activity reported better physical, functional, general quality of life, less fatigue, fewer physical cancer-related symptoms, and less general distress. Also, no, in terms of the mood and emotions, no, fewer patients actually reported depressed mood with more physical activity. Actually, the more physically active you are, the less fatigue symptoms you will feel. And this is especially true para doon sa mga pasyente na nag-undergo ng treatment. So, for patients who are undergoing or who are about to undergo cervical cancer treatment, no, especially chemotherapy, radiation therapy, very important ngayon pa lang dapat mag-exercise na kayo so that once you are already undergoing the treatment, mas less ang side effects. So, Dok, paano naman yung immune system namin? Will exercise still be able to help our immune system? Yes, no, actually moderate intensity physical activity like brisk walking, cycling, swimming can make your immune system much stronger. However, ang problem dito is kapag you are undergoing chemotherapy and radiation therapy at dumating sa point na na-damage yung bone marrow, mahirapang makarecover ang immune system. So may mga paraan ba paano natin mapoprotektahan ng bone marrow natin? Yes, there are, no? So number 1, make sure that you are eating a high fiber diet. So lots of fruits, vegetables, whole grains, and legumes. And may mga supplements ba na pwedeng makatulong? Yes, like Simply Nature PPARs. Actually, may study na ginawa dito, no, ang Simply Nature at ang ginamit nilang chemotherapy drug, no, is cisplatin. So actually here in this study, they investigated the health of the bone marrow, no, upon giving cisplatin, no. So we have the control over here. So makikita ninyo dito sa control yung integrity or yung itsura or yung architecture ng bone marrow is still very much intact. So this is a healthy looking bone marrow. However, kapag binigay yung cisplatin, nasisira yung architecture ng bone marrow. So this is actually the main reason why the white blood cells, yung red blood cells and the platelets go down when patients undergo chemotherapy and radiation therapy. However, kapag kinumbine ang microalgae, ang Simply Nature PPARs together with cisplatin, makikita ninyo na preserve pa ang health ng bone marrow. So actually, this is one product that you can consider when you are about to undergo chemotherapy or radiation therapy, no? And lastly, ang pinaka-important dito is to eat a healthy diet, especially a high-fiber diet. Okay? So ano ang benefit ng high-fiber diet when it comes to treatment or surviving cervical cancer? Number one, a high-fiber diet would be able to give lots of prebiotics to your probiotics. Okay? So ang probiotics is your gut microbiome. Ito yung gut bacteria that is residing inside your colon. Now, eating a high-fiber diet will give your gut microbiome lots of prebiotics. Kapag nag-interact ang prebiotics at ang probiotics natin, short-chain fatty acids are produced, which is called butyrate. At so itong butyrate na to, actually very important ito pagdating sa immune system. Kasi ang butyrate is not just an anti-cancer nutrient, no? It also makes our immune system stronger. So actually, one evidence, no, how this works, no, is they investigated this high-fiber diet together with immunotherapy on melanoma patients. And they found out that melanoma patients with a high-fiber diet or eating a high-fiber diet were 5 times more likely to respond to immunotherapy like pembrolizumab compared to those with low-fiber diet. So that's it for our webinar. For more cancer care tips, ask Doc Jansen. We are now open for your questions.
Good evening, everyone, once again. So we are now in the what we call AMA portion or Ask Me Anything portion. Tonight's topic is about cervical cancer, but you can still, of course, ask anything, even not about cervical cancer. So to answer all our questions for tonight, I'd like to call on once again our PPARS expert from Singapore, Mr. Shyan Lim, and of course, our lifestyle medicine doctor, Dr. Jansen Tan Kalalan. All right, Dr. Jansen, hello, welcome. Good to have you
Hello.
tonight.
Yeah, it's good to be back, no? Hello, Sheila. Hello, Shana. Hello, everybody who's listening. Topic tonight is cervical cancer. It's also one of the very common cancers, no, especially in women. And as we have discussed, no, it's one of the cancer that is prevented by simple vaccination. So so women, well, this is the same, no, for women and men, okay? Because for women, it's cervical cancer. For men, it's penile cancer. So that's gonna be a shock for most men, right? So simple vaccination can prevent this debilitating disease. Okay, so happy to see you guys again.
Dom, I heard that you had a very wonderful seminar on Tuesday. It was on Facebook Live as well. You were doing the case study of actually my friend, if I'm not wrong.
Oh, yeah. Yes, actually, her case is really a miracle. It's literally a miracle because the case is so rare. And with it being so rare, treatment options are limited. And when she came to me, she's already at stage 4. And one with multiple brain metastasis, and there is one brain tumor that was that spread or was located in a very sensitive area of the brain, which is the cerebellum. So that part of the brain controls the breathing, the movement. So had it just shifted a little bit, probably 1 millimeter or a centimeter, no, she would have experienced difficulty in breathing, or she would have experienced stroke symptoms, no? So and then being it so rare, no, she was given the usual cancer treatment medications. She responded so well, and she continued on to work. I mean, commuting every day.
Yes, because
so
she's a personal friend, a very wonderful
Yeah.
Super hard worker, amazing strong mom, right? Amazing strong
Yes.
mom.
Yes.
So,
So
all right. So glad that those of you who want to catch this, I think it's posted on our YouTube channel. Yeah, go check it out. Maybe Sheila, you can post the link to this video and pin it
Definitely.
there later. So for those who watch the rebroadcast, all right. So I see questions are coming in. Why don't we start?
All right, so we shall. Okay, for coming from Miss Kim, the first question is: Doc, is pop test still needed even after menopause?
yes, yes. Okay, so pap smear should be continued on until age 65. Okay. The only time that you stop pap smear is when, upon reaching age 65, then you have had three pap tests which are negative, then you don't have to continue on doing pap smear test beyond 65 years old already. Okay, so that's one criteria. Okay, so it's not a forever thing. Okay.
Excellent. Thank you, Doc Jensen. Okay, another question. Oh, coming from Miss Devay husband, who's also our avid viewer. Hello, thank you for watching us once again. Okay, her question is: what does cause cervical cancer? Causes cervical cancer.
Okay, the most common one is human papilloma virus. Okay, so well, that's the HPV virus. Okay, so the HPV virus is usually transmitted sexually. Okay, it's through sexual intercourse. It's through contact, skin to skin contact, especially the mucous membranes. Okay, if you know what I mean. Okay, so HPV, no, can yeah, aside from the genitals, it can also infect the oral mucosa, the inside of your mouth. Okay, that can also happen. But not all HPV can lead to cervical cancer actually, because there are a lot of HPV strains. Okay, so a majority of the HPV strains will only cause polyps, okay, or skin tags. But there are certain HPV strains which are high risk, so that those are the ones that can cause cervical cancer, and those are the ones that we have the vaccine for. Okay.
I'm just very curious. At what age can a person start or getting this cervical vaccine just to prevent, of course, the future?
Age 9. For
Age
this is for boys and girls. Okay, age 9, as early as
Wow,
age
that's
9.
very young.
Yeah.
Oh,
Yes.
okay, that's very interesting. Okay, thank you, Doc. Another question coming from Miss Luisi Castillo. Good evening. How to treat endometriosis, cyst, and adenomyosis naturally?
That is quite challenging. Okay, so immediately natural approach would be to eat properly, exercise. You need to have the proper supplements, no supplements that are quite strong. Supplements like Simply Nature PPARs, no, which has very strong anti-inflammatory properties. However, depending on the how big the cyst is and the location, sometimes just doing simple supplementation, eating healthily, proper, well, regular exercise, sometimes it's not gonna be enough. You have to have it surgically removed. Okay. But more often than not, with just these, no, if it's quite small, the symptoms are quite minimal, then there's still hope that it doesn't get worse.
Doc, I think I just want to pick up on what you said just now. Many times when we buy supplements, people are always looking for, oh, what's the vitamin C content?
Yeah.
And right now there is vitamin D is really important because of the pandemic. The 2 years, many of us are vitamin D deficient, right? And we're trying to find combination of vitamin D and zinc. But you know what? I caught what you said just now. Supplements like our Simply Nature people actually lower inflammation or help to modulate inflammation. This is something that many people don't actually look for that. We look for antioxidants, vitamin C, vitamin D, calcium, even calcium. Can you share with us how important is it to find that a supplement? Why would you? Okay, here's another way to ask it. Why would you look for a supplement that modulates inflammation?
Yeah,
Very
it's
because.
because if we modulate inflammation, or the product has, the natural antioxidants, packed naturally, as it exists in nature, it works synergistically with the body. So the effect is more substantial, and
Mm.
the effect is also more significant. If we just settle with the typical vitamins, minerals, they don't really work or have any significant effect. Okay, so that's why when you go do your research or Google, in the medical journals, okay, medical society recommendations, vitamins and supplements are actually least recommended because they don't actually offer any significant effect when it comes to treating diseases, certain diseases, except for vitamins and minerals deficiency. Okay. But deficiency in vitamins nowadays is actually very rare, okay? Because for that to happen, you have to stop eating certain food groups for a very long period of time. And foods nowadays are fortified with vitamins, even the processed foods. So, I mean, it's gonna be very difficult for a person to be deficient in one vitamin, okay? So for me, for your supplement to have a significant effect in your body, I would rather it be a whole food supplement like microalgae. There are many others, no? Your moringa, your flax seeds, a lot. There's a lot in the market. I would prefer those because they are packed in the right amount. Okay? It's not mega doses of this vitamin, this, in this, because when you segregate these vitamins, sometimes when they go into the body, it's not absorbed. Number two, if it does get absorbed, we do not know if it goes into the right places. Okay, so those are some questions that we have to consider, and we do not know the answer to actually. So to be safe, I'd rather go for the whole food supplement, which has packed with antioxidants, very strong anti-inflammatory properties, these things. Yeah.
May I just
No, I agree. Yeah, go, Sheila.
may
Yeah,
I
go.
just add, because this is a common comment from our clients and patients, because our PPARs, our Simply Nature PPARs tablets, they are very pleased to know that some parents, they look for vitamin C, and then on a separate vitamins, they're looking for CGF. What we have here in Simply Nature PPARs is that we have it all together in just one tablet, and they are very pleased about that. So
And it's natural, and
it
it's
is.
natural.
It is.
And it's very important, that actually when you choose a supplement, not just go for a particular vitamin D or mineral, go for the effect. And the effect here that we're looking for is anti-inflammatory, especially after COVID-19 and this pandemic. And almost everyone we know has gotten it once, right? So we're not talking about something that is uncommon. Almost everybody got hit with COVID once in this last 2.5 years, and that has one of the common effects of COVID-19 is an increased chronic inflammation in your body, and that over long term is going to lead to a lot of other diseases. Did you know that inflammation is even a root cause for things like Alzheimer's, dementia, schizophrenia? I was taking a look at autism. One of the primary causes of autism is actually neural inflation. Neural inflammation. All right. So yeah, inflammation is something you really got to take note of. It really is a source of many of our current day diseases. So thank you, Dr. Johnson, for pointing that out. We always look for vitamins and supplements that are good, rich in vitamin C, but we never look for one that actually is anti-inflammatory. So PPARS is one of them. So thank you for that tip.
Thank you, sir. Thank you, Dr. Johnson. Okay, another question coming again from Miss Deve husband. Sir, is it correct cervical cancer deals with the cervix of the womb? And the other question is, what can anyone do to prevent cervical cancer for preventing through the whole body? I think you've mentioned already the HPV vaccine, right?
Yeah.
Okay, and
Yeah.
for the
There's
other
another
question,
one. Okay, yes, it's the cervix of the womb. No, not this cervix, okay? Different cervix, okay? It's the cervix of the womb. No, In Tagalog, we call it yung kwelyo ng matres, or in English, the direct translation is the color of the uterus, okay? Or the color of the womb, okay? And aside from getting vaccinated, there's another way, to prevent cervical cancer. It's to be loyal, okay? Don't have multiple sexual partners, because actually having multiple sexual partners is a risk factor for this, okay? Yep.
Excellent. All right, by the way, for those of you who wish to have a consult with Doc Jansen Tankalalan, the link for you to be to book a consult is in the description link, or you can just simply comment down how to consult. We'll get in touch with you individually after the program. Okay. Another question coming from Ms. Zai Zai. Hi, Doc. Good evening. How to treat cervical intramucosal neoplasia 3 in a natural
Okay,
way?
sorry to interrupt, because I saw a question by Louise asking for location. I don't know whether she's asking where Doc is located, or the link will be pinned on the comment section, so you can look at it on the top. Doc Jansen is available for a teleconsult. Of course, if you are living in the Metro Manila area and you would like to see Doc Jansen in person, you could have a consult in person. But if you're in the province or somewhere further, or if you are not feeling well and don't want to brave the traffic, which I totally understand, Philippine traffic is a war zone.
Crazy.
Please avail the teleconsult. I think that's a really good way to catch up with our doctors in our busy schedules. Yeah, sorry, back to the question.
All right, one more time with the question. Okay. Hi, Doc. Good evening. How to treat cervical intramucosal neoplasia 3 in a natural way?
Okay, that specific term is the precursor of cervical cancer. Okay, so how do we treat that one? Immediately, healthy living. Okay, so eat properly. You have to have the proper diet. You have to exercise. Okay, because just with this just two, okay, we can actually reduce the risk of developing cancer. Now, most likely you are infected with HPV. Now, HPV infection will also lead to inflammation. So the inflammation itself will add on to the damage. Okay, so that's why you have CIN3. So that's CIN. Okay, that's the shortcut for this kind of condition. Okay, so however, since it is CIN3 already, okay, just one more step, that would already become a full-blown cervical cancer. Okay, because CIN3 is that the neoplasia, or the cells, have already invaded all the mucosa, all the surfaces of the skin of the cervix. Okay, so if it spreads further, that's gonna invade the, how do I call this, the submucosa already. Okay, so that one is quite dangerous already. So that's one, eat healthily. Okay, another one is to actually have the lesion biopsied. Okay, have the lesion removed. So we have something what we call, or doctors have something that we call as a conical excision. Conical excision. Okay, so your OBGYN is just gonna get a piece of that area which has the CIN3 lesion. Or if there's a visible lesion that your OB is just gonna get that, and then that's it. Okay.
Doc, just to clarify, are you saying that if this person is diagnosed with CIN3, it's still reversible?
Yes, it can be reversed. Yeah.
Yes.
However, well, in theory, it can be reversed. No. However, since we're talking about real life scenario here, I will not just rely on lifestyle change. I would utilize supplementation like Simply Nature PPARs. I'd use that. And also, of course, better to have it removed since it's just so small. Don't let it, invade further. Yeah.
Yes.
So if I were you, I'd consider those three options.
Thank you, Doc. All right. I think that a while ago we were talking about the inflammation. So the Miss DeVay husband is asking, why is inflammation, or why does inflammation affects the human body, and what really causes inflammation?
Okay,
I'll-
inflammation. Okay, so yeah, go.
Yeah, I'll do the short one, then you do the detailed one. Okay. Inflammation
Okay.
is actually a defense mechanism. The dog. I always notice people when they take supplements, we make something that is bad all the way. We always misunderstand. We want no inflammation. We want only antioxidants, but you actually need oxidants too. So to everybody, when we are supplementing and when we're talking about our body, we got to understand that everything, even what seems to be bad for our body, is actually necessary. It's just that it goes too much. All right. So inflammation is when your body reacts to send nutrients to the place where there is an injury or an invasion by external virus and bacteria. So without inflammation, you don't have an immune system that works, right? However, with an overactive inflammation, you cause the body to be stressed out and it breaks down. And of course, that's going to tax your body and that's going to wear you out. And when you have chronic inflammation, it's like, I guess my point of view is like you sitting in an acid bath. Can you imagine you bathe yourself in acid? You're always slowly burning yourself up. So that's what I view chronic inflammation as. And that leads to a lot of issues such as clogging up your arteries because your veins are inflamed, they become rough. So all these cholesterols collect very quickly and then your arteries get clogged. It means that your joints hurt. It's so many, and your brain functions get affected. So inflammation is actually something very important that your body needs to regulate, right? So you don't just want anti-inflammatory, you want to modulate, which means to regulate your inflammation because you still want inflammation, but not too much. So you got to control it in the middle. And yeah, that's the short answer. Doc, anything I missed
Yeah.
out?
Here's I would put inflammation. No, for me, inflammation is like fire. Okay, so
Oh, that's a good one.
yeah, we use fire for what? For cooking. Yeah,
Mhm.
for light, right? For nourishment, to make us warm. So in that sense, fire can be very beneficial to the body. Same way with inflammation. So inflammation can be beneficial for the body in what sense? In combating invaders. Okay? So your bacteria, your viruses, the fungi, these things, no? In the healing process, inflammation is needed. Okay? However, too much inflammation, or if you are exposed to too much fire, okay, so that can also be dangerous because fire can burn. Okay? It can burn our house down. Okay? It can combust everything in its path. Same way with inflammation. Too much inflammation can be very damaging to the body. That's why you experience joint pains. Okay, you experience fever. Fever is inflammation. Okay, the redness of your face when you are flushed or when you are stressed or when you just ran, that can be a sign of inflammation. Okay? So there are a lot of things that can be or that can manifest as inflammation. So in the body, there are pro-inflammatory factors and anti-inflammatory factors. Okay, so the key here is a balance of both. The pro-inflammatory factors should overcome the anti-inflammatory factors when we have an infection, an ongoing infection. Same way, no, anti-inflammation should kick in when the invaders are already dead. Okay, so that inflammation can go down because if your body is in an inflammatory state most of the time, that can be very damaging. That can damage a DNA. Okay, so same way, no, if you have too much anti-inflammatory nutrients or factors, no, it overwhelms the pro-inflammatory factors. How are you gonna fight off the bacteria, the viruses? Okay, so infection, these things, no. So it has to be a balance. The problem is we do things that tip this balance off. Okay, in such a way that the pro-inflammatory factors are slightly higher than the anti-inflammatory factors, and this happens for a very long period of time. This is what we call as chronic low-grade inflammation. So the chronic low-grade inflammation, actually, that one leads to different diseases that we notice nowadays. So your diabetes, your hypertension, your cancer, your autoimmune diseases, your arthritis.
Doc, I mean, two amazing ones that are so dangerous: autoimmune diseases and cancer. Many people don't realize it really starts with inflammation, and that's just so important.
Yeah, so that's inflammation in a very short in 10 minutes, probably 5-10 minutes, no. But in med school we study inflammation for yeah, I think it's for two lessons, 2 hours, yeah, 4 hours. Yeah, everything is there. Yeah.
Thank you so much, Sir Sean and Doc Jensen, for making this explanation very clear and very layman's term. I like that you used acid and fire as an analogy to it. Thank you so much. Okay, so another question. This one is very interesting. It was sent to us privately by Miss Kyle. Can a transgender get cervical cancer?
Very good question. Yes. Yes. Yeah, yeah. But yeah. If only you are already you already had the sex change surgery. Okay, because the cervical stump, they're gonna create a cervical stump, or a baby or a vaginal stump. Okay, so that area can get infected with HPV. So that area can actually develop into tumor. Okay, eventually. So although it's quite rare because that area doesn't have the cervical it doesn't have the cervix, the tissue of the cervix where cervical cancer usually occurs. Because for cervical cancer to happen, you have to have that specific cells as well. Okay. However, since it's a cervical stump and HPV, it's still a mucosa. So yeah, we don't know. It can probably form a tumor there. So yeah, it's a possibility.
It is a possibility. Very interesting. Okay, thank you, Dr. Jensen. Okay, another question coming from Kimberly. Can contraception prevent cervical cancer?
No, it can. Okay, it can. Why can't it? Even if you wear a condom, okay? It's because the bodily fluids can still get out of the condom.
Wow, this
Okay.
this is a big one. Yeah, because
So,
the cervical cancer is actually caused by a virus, right? So this is different. It's not like regular cancer is not communicable. You can't spread normal cancer. So
exactly.
you don't need to run away from cancer patients, okay?
Yeah.
But cervical cancer
Exactly.
is a special one, is virus. But I'm surprised. We always thought that condoms are used to stop VD, right, venereal diseases, sexually. So it doesn't really work for HPV virus.
Yeah, in my opinion, it can only reduce your risk of getting infected, but not totally eradicate the risk. Yeah, precisely because bodily fluids can escape out of the condom. I don't want to go into more details, but you get what I mean. Okay, for everybody who experienced.
When you said that, I remember a Friends episode. For those of you who don't get it, means you're very young, where Joey freaks out and says, "What? You mean condoms don't even work 3% of the time?" Because because on the box it actually says condoms are effective 97% of the time. So there's a 3% chance you can still get pregnant even if you use a condom. So I think sperm is a lot bigger than virus in terms of size. So right, if sperm can escape, I think the virus can go through as well. So thank you, Doc. That's really a good thing for us to know. That yeah, that's a good question and that's a very important answer.
It's exactly. Actually, I just want to encourage everyone. Your questions might be very relatable to other people, and these are very good questions. Keep it coming. Your questions are very much welcome still. Okay. And before we go to another question, I'd like just want to greet Miss Melanie Michelle coming from from the Palau Pinang Hospital. Okay. Thank you so much for watching us. Also, our new I hope avid viewer as well would be Miss Pamela Johnny. Thank you for watching. Lizue Majola, and of course, Ms. Jai Jai. Thank you so much for joining our webinar for tonight. Okay, another question sent to us privately. Okay. Do I still need to do pap test or pap smear even if I am already HPV vaccinated? Coming from Miss Stephanie.
Oh yes. Oh yes, you still have to undergo. Because the HPV vaccine is not 100%, okay? It only gives you immunity to the more common strains of the HPV virus. And yeah, the more common strains that causes the cervical cancer. But it is not 100% because there are some other strains that, the rarer ones or the more uncommon ones that can lead to, your cervix getting damaged. Okay? So, or your cervix getting infected with the HPV virus. So, even if you are already vaccinated, you still have to undergo pap tests. Okay? This is for early detection. Okay?
Thank you, Doc. Okay, another question. Okay, can PPARs replace chemotherapy? Coming from another one from Miss Kimberly.
Let me take that one.
Okay.
Okay.
Common question.
If you're one of those persons who have very strong personal reasons why you don't want to take chemotherapy, then PPARS is your best hope. It should be your foundational, which means, again, my approach to cancer is that you do everything that you can. All right, surgery will give you 20%. This protocol will give you 10, this other protocol will give you 5. Having a healthy lifestyle will increase another 20%. You just want to increase your success rate in treating cancer. But of course, don't go around trying every crazy product out in the market, all right? You could do yourself a lot of harm as well. So if you're not sure, ask us or go for a consult with Dr. Johnson, right? So that he can comment on what protocols you think would like to try. Now, can PPARs replace chemotherapy? PPAR works very differently from chemotherapy. I'll let you understand, then you understand how to choose. You make the choice, but here it is. Chemotherapy is like a bomb that you throw at the cancer tumor. It will explode and it will hurt the things beside the bomb, all right? So it's very destructive, but that's what you want. You want to destroy the tumor, okay? Along the way, it will bomb other healthy parts of your body as well. The good news is that when you take PPARs, you help to protect the other body parts from the effect of chemotherapy. You reduce it. So basically, everybody else runs into the bomb shelter. So the cancer tumor takes the most damage, okay? Now, if you were to use PPAR alone, what PPAR does is that PPAR strengthens your own body's immune system to attack the tumor, okay? And it also does things like lower your blood sugar, lower your blood cholesterol, lower your inflammation. All these things add up together, makes it hard for the cancer to grow and do well. So you are starving the cancer and you are turbo boosting your immune system. We have many videos that go into technical. I'm sorry, I didn't want to take everybody's time, so I'll use a simple illustration. It'll just turbo boost your immune system. It works on the dendritic cells. It works on the maturation of your stem cells in your blood, in your bone marrow, so that they become part of the immune system, so that you will have a high count of red blood cell count, white blood cell count. So all these will be what your body will use to fight cancer. So again, on one side is the bomb. On the other side is strengthening your own body to be able to fight cancer successfully. Of course, if you ask me if you can use both, right? But if you have specific reasons why you want to avoid chemotherapy or radiation therapy, then Simply Nature PPARs will be your best bet. That will be the basic thing that you should take. And on top of that, you add things like lifestyle medicine. So why not just, for example, change your lifestyle? Because you have cancer. And if your cancer is aggressive, time is not on your side. That's why unless you want to eat 100 carrots worth of beta carotene. You can't do that in a normal diet, even no matter how hard you try. That's why when it comes to cancer, supplementation is really necessary. So is living healthy, because you don't want to work opposite whatever you're doing. And of course, lifestyle change fundamentally helps you beat cancer long run, right? Even after you first beat the cancer one time, it can still come back. So lifestyle change, lifestyle modification is so important to make sure that you stay cancer free. But I hope that answers your question. Chemotherapy is like a bomb. PIPA protocol is a natural way of boosting your own immune system to successfully fight cancer. If your condition allows you to use both, I would use both. But if there are reasons why you cannot or don't want to use chemotherapy, then yes, Simply Nature PPARs will be your best bet. But as you can see, it doesn't replace chemotherapy. It works differently from chemotherapy, but it has the same effect. It goes after your cancer, helping you fight cancer. Doc, is that an okay answer?
Would you like to
Yeah,
add
I think
anything?
you did it
Okay.
perfectly.
Okay.
Okay, thank you, Sir Sean. Okay, I think that also answered the question of Miss Tess Latham, who is also asking if because she's a cancer patient, stage 3 endometrial carcinoma. So she is on PPARS powder and PPARS tablet, and she is also asking if there's a natural way to heal herself. So
Yes, there it is. You're already embarking on it. And for Tessa, if the powder is doing well or did well, or for example, it arrested your cancer growth, and you want to look at the option of doing more, you can consider the liquid. All right, that is going one step even further. But if you're doing well with the PPAR powder, and you're happy with that, then stay on that protocol. Remember, hence the fighting cancer is two parts. You gotta manage your funds as well. I mean, I just want to be honest with everybody. The protocols that you take, be honest with our, if you're getting it from Dr. Johnson, be honest with his healthcare specialist. If you're getting it straight from us, be honest with our customer service officers. Just let them know if you have budgetary budgetary constraints, so that we can plan out to make sure that your treatment is something that you can sustain, diba? That you will be able to finish it and do well. So helping our patients and helping our clients plan the finance part of their cancer fight is also something that we want to do, because we want to be with you the whole journey until you get fully well. So planning finances is actually one aspect of successfully fighting cancer.
Exactly. Thank you, sir. We actually, I just want to add very, very quickly. We also have another patient of the same case, also endometrial carcinoma. She is also not undertaking any treatment like chemo or radiation. But good news, she just shared it earlier this week, is that her cancer markers actually went down. Really,
Hey,
really
wow.
well.
Oh, is this your patient, Sheila? Is this one of your clients?
She is.
Oh, wow, that's so nice. So
Thank
live
you, Lord.
again, everybody, live examples, live cases. So I hope that encourages you. If it's you, I hope that encourages you. If it can happen for someone else, it can happen for you.
Okay. Thank you, Sir Sean. Thank you, Dr. Jansen. Another question. Okay. What is the best form of sweetener for cancer patients?
That's a
Oh,
good
it's a
one.
Form of
question.
sweetener is
I know the answer. I've
oh
listened
yeah.
I listened to what you've been sharing, Dr. Johnson.
Yeah, okay. The best sweetener for cancer patients is fruits. Okay, it's fruits.
And I know it's date sugar.
Yeah.
Sugar made from
Sugar.
dates, right? Yeah,
Yes.
not my best.
Date sugar and then blackstrap molasses. Those are the ideal ones for cancer patients. Okay, if you are thinking about artificial sweeteners like stevia, please don't. Okay, erythritol, please don't. Okay, because artificial sweeteners can make your blood clot easier. Okay, cancer patients, your blood in general, okay, all cancer patients, your blood clots easier compared to a regular person. So if you use artificial sweeteners, yeah, that you can develop thrombosis or blood clots inside your inside your blood vessel. That blood clot can dislodge, okay, and go elsewhere in your body. If it goes into your lungs, you'll have difficulty breathing. If it goes into your coronary arteries, you can develop a heart attack. If it goes to your brain, you can develop a stroke. You can die. Okay, so be careful. Okay, so for sweeteners, yeah,
Did you say stevia? I thought stevia was a natural sugar.
it has erythritol actually. Yeah, it's
Oh,
an artificial sweetener. They add something in there.
so
So
stevia itself is natural, but to process stevia, they put something else. Wow, it sounds like a bit and switch. Like we thought it was healthy. Oh,
I also thought it was good previously, but I saw an article. Actually, this was a debate. No, this was a debate. The debate was erythritol itself. Is erythritol because erythritol in and of itself before, no, it's commonly used as an artificial sweetener. Erythritol doesn't get absorbed into your bloodstream. So its glycemic index or its ability to influence your blood sugar is next to zero. Okay, you just pull it out, so it'll just offer you that sweet taste. Then that's it. Yeah, then eventually you poop it out. It's similar to lactulose. Lactulose is it's also a sugar, tastes very sweet, but you don't get to absorb it. It makes it makes it easier for you to poop. Okay, similar to lactulose, so erythritol. However, erythritol is an alcohol sugar. So they've studied, no, why do people who use erythritol commonly, okay, or use erythritol frequently, why do they have a higher chances of developing heart attack or heart disease or stroke? So they found out that yeah, it makes your blood clot easier. So there you go. So when I encountered that, I immediately I have to change my recommendation then.
To all our audience, let me share with you how when I receive information like what Dr. Johnson said, where there is still debate there, I won't join the debate. You know why? Because there's another choice.
Yeah.
Get it, everyone? You don't have to defend stevia because you're not an advocate for stevia and the company's not paying you. You are a patient who wants to get healthy, right? And since there is a debate, whether it's totally, if they have agreed or not agreed, it doesn't matter because there's another
Correct.
choice. You don't have to
Correct.
take stevia, right? There is another
Correct.
sweetener. So don't join the debate, right? Go
Yes.
for the thing that is for sure good for you or healthy for you. Nobody's paying you to be pro stevia or anti stevia. Don't get in the debate. Just go and choose the safer sugar, right? Just use date sugar, right? Or what about
Be
agave?
practical.
What about agave? What about agave?
Agave is as of now, agave is still okay.
Okay, agave is still okay, right? So guys, I hope that's a good, simple advice to everyone. Sometimes when we're so health conscious, we get so involved with our choices that we end up being an advocate. But as a cancer patient, don't worry about it. Just choose the one that's good for you. You have choices. You have better choices. So just go with the right choice.
Couldn't agree more. I agree. Thank you. Thank you, Sir Shyan. Thank you, Dr. Johnson. Okay, the next question is sent to us privately by Noel. And the question is how to deal with heightened loss of appetite and nausea.
I have to get the proper context.
Okay,
I have to know your
you get the
case.
context. I'll inject the answer right now. First of all, take Simply Nature Peoples because our research and our clinical our research and then our experience with actual patients tell us that their appetite increases. All right. So and their nausea goes down. So if you are undergoing chemotherapy, radiation therapy, take Simply Nature PPARs, right? If you're not taking the extract, try the tablets first. If the tablets are not working, you probably need to get the extract so that number one, you protect yourself from the chemotherapy side effects, especially damaging your bone marrow, which is where your immune system is produced, your red blood cell and white blood cells, right? And then our very common feedback from all our patients and clients is that they get back their appetite. Doc, you even had patients, I mean, I know you have patients who put on weight while they went on chemotherapy because they were on Simply Nature PPARs. So there could be many reasons why you lose your appetite. Sometimes your taste bud change because of the chemotherapy. Of course, most of the time it's because you're fatigued and you're tired and you just don't feel well, so you don't feel like eating. The one thing great about the PPAR protocol is that it gives you strength. And when you have strength and you can walk about, imagine if you're walking about, you get hungry, and hence your appetite also comes back. That's just a very basic level. And now Dr. Johnson will tell you the people one.
Yeah, I don't know really what's your case, right? Because there are a lot of conditions that can produce these two symptoms. So I think it would be better for you to consult or give us more information so I can help you. But on the get go with these two symptoms, no, well, the simple medication can resolve that. I mean, if you feel nauseous, omeprazole, PPIs, antacids can help. Simply Nature PPARs, actually, I've used it for one patient of mine who has hyperacidity, and it went away. So there you have it. Yeah. So that's just one. Okay? If you don't have any appetite at all, then Simply Nature PPARs can also help because it's also a packed with nutrients already, so it can give you your needed nutrients for the day, if you are not eating so much. But of course, to restore your appetite, I have to know more information.
Okay, which is, by the way, for those of you who wish to have a consult with Doc Jansen Tangkalalan, please the link for you to be consulted or to book a consult is in the description box pinned on our comment section. Or you can just comment down how to consult. We'll get in touch with you individually. Okay. All right. Another question going back because we were talking about sweetener. Another question about it coming from Mr. Ramir. How about monk fruit as sweetener? Is it
That's a
Monk
good
fruit,
question. I like to eat
it's
chocolate
okay.
with monk fruit.
Monk
Okay,
fruit.
that's
Yeah,
great.
monk fruit is okay because it's a fruit, right? But again, if we are gonna compare antioxidants, if it's the whole food monk fruit, okay, then that would be best. Okay, but if you are talking about something a derivative of monk fruit, then I don't know the antioxidant content if it will retain it. Okay, if it's processed already, like date sugar, right? Because date sugar and blackstrap molasses so far are the sugar or the sweeteners that still retains its antioxidant. So that would be better compared to the others.
Doc, can I check with you? Where do you buy date sugar?
Healthy options.
Okay. Oh, because for everybody, dates are actually very fragrant. So I suspect that the date sugar would have a bit of the dates aftertaste. That will actually add a new dimension to it's not just sweet. It has that
Yes.
fragrant smell of dates. Okay, I'm gonna this weekend try date sugar because as a Chinese, there's a tea that's very nice, date tea made from red dates. It's very fragrant. So I'm curious. I'm gonna eat my oatmeal next week with date sugar. I currently eat it with Muscavo sugar. And Doc, you made me so sad. I always thought that Muscavo was healthier,
Yeah.
but it's not really much better, is it?
Yeah. If I were you, I'd rather choose date sugar.
Okay, let's not debate about Muscavo. Let's just choose the best one, right? I'm gonna eat date sugar next week with my oatmeal. Yeah.
Muscovado. Okay.
Sorry.
That's a good point.
Did I
Muscovado.
pronounce that word wrong? What was it? What's it supposed to be, Sheila?
Muscovado.
Muscovado. All right. We don't have that in Singapore. I learned about it only when I came to the Philippines. In Singapore, it's only white sugar and brown sugar, which is really the same sugar.
I think muscovado is getting a more common here, and it's in the grocery. It's beside cocoa sugar. Yeah. Okay. So another question. Oh, coming from Ms. Tess again, is organic milk okay as an additional calcium for bone and muscles? Good question.
No, no, it is not. You know, I sometimes I wish Beth was here, no, because Beth
Mm,
should be able to answer this question already.
agree.
Well, okay. To build muscle and bones, okay, you do not need milk for that, especially to build bones, okay? Because in countries where dairy consumption is very high, they also have the highest rates of osteoporosis. What an irony,
Mhm,
okay?
mhm.
Very ironic, yeah? So, in countries where the dairy consumption is quite low, these countries also have the lowest incidences or lowest rates of osteoporosis. You know what countries they are? It's in Asia, mostly Southeast Asian countries, Japan, South Korea, China. Yeah, these Asian countries. Those countries which have high rates of dairy consumption and osteoporosis are the European countries, Hungary, Finland, these countries. Okay, very ironic. Okay, so in principle here, no, for you to build bones, yes, you need to have calcium, but you need your calcium to go into your bones. How do you do that? Okay? You actually do not need any vitamins for that to happen. You need to do something, which is to move, okay? Which is to
Mm.
exercise. You have to put strain on your bones so that the bones will adapt and make themselves stronger. Okay? So to build muscles, it's also the same principle. You do not need huge amounts of protein to build muscles. Okay? You don't. What you need to do is to have the right exercise regimen. You have to have you need to do more resistance exercises, weightlifting rather than cardio exercises, okay, or the aerobic exercises to build muscles. And for that matter, you just have to be physically active, you know, to retain your muscle mass. Okay, so your muscles won't shrink. Okay, it happened to me. I mean, back then when I was in med school, I was physically active. Okay, so I was able to build my body. However, the time came when I need to study for board exam. So you know, exercising went away. So I was just sitting around the whole day studying. Okay. So my body shrank. I was really thin. I grew thin back then. So my dad was actually saying, Johnson, you look like you're sick. What's wrong with you? So yeah, I mean, it's because I was physically inactive. The amount of physical activity that I was doing considerably went down. That's why my muscles shrank. Same way, astronauts when they go to space, their muscles shrink. You know, they have
Oh, and their bone
to
density goes down. I am
yeah,
sure the astronauts were taking calcium.
yes.
Mhm.
Calcium milks probably not, but I think they would have been consuming plant-based milks, but not
Mhm.
dairy. Yeah, not dairy because dairy is an animal protein. The animal protein will siphon out the calcium from the bones instead of putting in the calcium to the bone. Then you'll just pee out your calcium.
And that's
Mm.
what this question. First of all, let me give suggestion. If you want to drink milk because of you like the taste, and because sometimes we ask the question for medical reasons, but actually we are motivated by taste. Then I want to share with you the solution is oat milk. Okay, oat milk tastes incredible in all your drinks, from your Milo to your coffee. It will just be a great replacement for dairy milk. All right. It's so much better than soy milk to put into things like coffee and hot chocolate and and Milo. Okay. Now the ones about calcium is this, as Doc Johnson said, right? Your bones cannot be stronger than a caribou or a giraffe or a deer. They have very strong bones, and you do notice, right? They don't drink milk. No animal drinks milk except human beings. Because every animal stops drinking milk when they grow up. Only we drink milk when we up to our ripe old age. Okay, so milk is not that dairy, such as cheese, is not really the best source of calcium. As Dr. Johnson said, and you need to exercise as well. So you can't just drink milk and not exercise. Your bones won't get strong. It's better to eat vegetables and go for some resistance training, and you will find that your bones will be strong. All right. Just look at Shaolin monks. They only eat tofu and vegetables. They're vegetarian, all right? They can break boards and stones with their hands, all right? So obviously their bones are very strong. They don't drink milk. Okay? Monks don't drink milk. Okay, so I think that should give us an example. Yeah.
Excellent. I just suddenly remembered a scene from Beef in on Netflix. They
Beef?
mentioned,
Oh.
yeah, they specifically mentioned that Asians are most Asians are lactose intolerant, and I remembered what you said last webinars.
We are normal.
Right? We are normal, and that's why.
Yeah, you're supposed to be lactose intolerant. All right. Yeah.
All right. Thank you, sir. Thank you, Dr. Jansen. All right. Another question comes from Miss Marian. Oh, okay. I misplaced the scooper of my PPARS powder. What substitute can I use?
Oh.
Because
Okay, number one, do not use a metal spoon. Okay, do not use a metal spoon. All right, first thing. That's the reason why we use a plastic, and it's not just because we wanted. It's not just because we wanted to make a small spoon, so we use a plastic. Okay. All right, because metal carries a charge. Okay, just like if you eat Manuka honey, which is like 4,000 pesos for one small bottle of honey, they will usually give you a wooden spoon, all right, as a gift. All right. If they don't, please ask the person that's selling you the honey to give you a wooden spoon. Okay. Do not use metal for anything that has live enzymes. Okay, because it will destroy the charge will actually destroy will break the cell wall of the enzymes. Okay. So number one, don't use a metal spoon. So what do? Okay, there's one simple way. Get a straw. Okay, get a straw, which is easy to find, and slice it diagonally to create like a little plastic spoon for yourself. Okay. Remember to make sure you round off any sharp edges so that you don't poke your own tongue when you put it in. Okay. Or you know, when you take McDonald's sundae, or was it icy, they used to have straws at the end. It's flat. It's like they cut open a straw and they press it flat, so it becomes like a little shovel. Right? So again, go and experiment. Just go to McDonald's, get a lot of their plastic straws, or go somewhere and get their plastic straws. You cut it and use it to form a small spoon to replicate the plastic scoop that was missing from that you lost from your pipa jars. Okay? I hope that little hack helps you. But don't use
Another solution.
another solution, Doc.
Yeah.
Go ahead, Doc.
Another solution
Go ahead,
is to
Doc.
buy another one.
Oh, I like that one. I like that one.
Okay, I like that one. Okay.
Yeah.
You can buy a spoon or
You're
the
gonna use
scooper
it anyway. You're gonna consume
with
it
free.
anyway.
Yeah, buy the scooper with free powder. How's that? There you go. Thank you, Doc. Thank you, Sir Shyan. I believe that a lot of our powder users can relate to this very much. Okay.
Jokes aside, okay. Don't use a metal spoon. You can use a wooden spoon, right? By now, I think you have a rough idea what's the quantity. Okay, the good news is that it's okay if you take more. It just works even better. Okay, the dosage is not an issue as for cancer patients. It's just yeah. So just don't use a metal spoon. You can try for straw. You can use wooden spoons.
It just goes to show that our PPARS powder actually has no preservatives and is very effective. Okay. All right. Another question comes from Tesla. What fruits and veggies should cancer patients avoid? Are there any?
There's no fruits and vegetables that you should avoid. There's none. It's just that there are certain fruits and vegetables that are more effective for certain types of cancer. So fruits and vegetables are not created equal as well. Okay. But in terms of avoiding or harming you as a cancer patient, it's not really something that you should worry about.
But in everything, everybody remember, in everything, moderation. And I know some people like to take juice. Please remember that when you juice, you're actually eating a lot of fruits, okay? Because 3 whole apples might not even make 1 full cup of apple juice. But that's actually quite a lot of apples already, 3 apples. So again, if you're juicing, if you're making blending like smoothies and so on and so forth, it'll be great to have a consult with Dr. Johnson just to check the quantity that you are taking. For vegetables, it's safe. You can't eat too much vegetables. But for fruits, I'm just concerned about the sugar content. It still does contain sugar, especially if you juice. If you blend, it's much better because there's still fiber that holds the sugar. But if you do juicer, you might lose the fiber and you end up with a sugar spike, which is not good for you.
It's one thing that I like about how Doc Jansen does his consults is that not only the food is being really discussed meticulously, but also the other supplements that they are taking. Doc Jansen is really digging into those details as well. So for those of you who wish to have a consult with Doc Jansen, the link for you to book a consult is in the description box, pinned in the comments section. Okay. All right. Maybe last 2 questions. Another question coming from Miss Noemi from our Viber. Okay, she sent this to our Viber. What is the difference of PPARS Premium or the pure forms and the PPARS Plus?
Okay, I'll answer this one. The PPARS Plus is usually prescribed by our doctors. Okay, the PPARS Plus has an additional ingredient, which is polyphenols from the grape skin. Okay, it's not resveratrol, but it does contain resveratrol. Resveratrol is only one type of many polyphenols that you find naturally in red grape skins. Everything we do in Simply Nature, we try to keep it intact. So instead of just extracting and give you one polyphenol called the resveratrol, we give you the full, complete, natural range of polyphenols that you find in red grape skin. Okay. Which is better, the premium or the plus? Difficult to answer, right? They are both good. Okay. It's like saying, do you want pure orange juice or do you want to mix it with a bit of apple juice, right? If you mix it, then you have less orange juice, but you have the goodness of apple juice. All right. So it's very hard to answer. I would say that if you are taking extract, our extracts are pure. If you are taking extracts, then why not go for the PPAR Plus, because that has additional grape skin polyphenols. So you have a wider range of things. Okay, if you are not taking extracts, I would say go for the pure one. If you're purely taking tablets, I will give you another advice: alternate. Take the pure tablets for 3 months and then take the plus for 3 months. It's just like eating bananas. Sometimes you eat Lakatan, sometimes you eat what's that? Devonish, is it? What's your bananas?
Cavendish.
Cavendish. All right. So there is slight variation. The difference is not huge, but I will tell you why we added polyphenols, because the polyphenols work in a different direction from PPAR agonists found in the microalgae. So it's actually complementary. All right, it's actually complementary. So yeah, you would think that if you mix 2, it'll be better. That's the general understanding. But there is also advantage in having pure PPAR tablets. Okay? Because it's pure. It's not mixed with anything. Okay, so for me, honestly, for me personally, I actually mix it. I don't mean mix it. That means for some months I take the plus premium, then I alternate with the plus. So that just for a change in the system.
Thank you, Sir Fran. Okay, I think this will be our last question for tonight. Coming from Miss Lynn from this. I like that the questions are coming from all the platforms that we have.
Oh, it's from
Just not-
YouTube, it's from personal.
Yeah. We have the Viber, even the Lazada today. Thank you for your questions. Okay, so the question is it okay to take Immunomax with PPARs for 4 years old with primary complex, also taking kids kit?
Yeah, it's
Okay.
okay. But let me check the last one. What's that called? Kids what?
Kids kit.
Kids skip. Well, Immunomax is a beta glucan. Okay, so that is fine taken together with PPARs. It doesn't have any redundant effects. Both will work well together. Especially for for a kid who has primary complex, no, that will make his immune system even much stronger. However, the primary complex, if it is causing symptoms, that has to be treated. Okay. Um, Kids skip. Wait. Let me see. Let me see. Kids
Kids
skip.
kit.
Kids
Not
kit.
kit.
What's
Kit.
this?
Kit. I
Uh,
kit, sir. Kit doc. Kit. KIT.
okay. I saw it. This is a multivitamin. Is this a multivitamin? No, it's okay. This is the medication. Yes. Continue the medication. Why? Because these medications have toxic effects on the liver. Um, yeah, it can also produce. It can also increase the uric acid of the kid. Yeah, so better to take supplementation. PPARs plus would be very good because that can neutralize the damaging effects of the medication, or it can help the body heal, no, faster, even when your kid is taking these medications. Okay, so yeah, you're on the right track.
You know, Doc,
It's good
I
that you
like
mentioned.
your last.
Yes, go ahead.
I mean, your last answer is very interesting because just like the way PIPA protocol protects the bone marrow from chemotherapy damage, most drugs, even though they are, how shall we say, they're safe for consumption, yes, they do still have side effects. It's just that their benefits outweigh their side effects. However, by adjusting your lifestyle, you can actually help to minimize the side effects. And Dr. Johnson, you just mentioned that by taking PPAS tablets, it will help the kid to offset any side effects that he may have from some of his drugs. That's a very interesting and important perspective for everyone to have, right? And in Chinese medication, you know, you always watch the movies, and the doctor comes out with a weird concoction, some barks, some leaves, and maybe some insect shells or something like that, and then you boil it together. For everyone's information, this is actually strategic. Okay, maybe out of the 8 ingredients, only 3 is for the illness. The other 5 ingredients is to balance off the side effects of the 3 ingredients that have effect on your illness. However, when it comes to Western drugs, they just try to refine it so that the side effects become minimal, but they don't actually have a balancing component in the drugs to balance off the side effect of a drug. So that's not a pharmaceutical concept. They don't put something to neutralize the side effects of the drug in the drug, right? They don't do that. Instead, what they do is they control dosage, they control the purity of the drug. Every drug is produced with a 0.01% deviation. That means every single pill is almost identical. So it's very controlled. Whereas the other approach is to use things to counterbalance. And what Dr. Johnson just suggested is just that by eating something nutritious, you offset or you help the body repair any side effects your drugs might be having on your body. I think that was an interesting point that was brought up and an important one.
Yes, I'm also very pleased that Dr. Jansen mentioned that it actually is a contradiction to if the liver might get affected badly, because it's a common question from
What
our
happens, Doc?
clients.
What happens,
Right?
Doc, when your liver gets damaged? Please share with us.
Okay, there are a lot of things now that can happen. So for this one, If your liver gets damaged, of course, the amount of protein that it will produce can go down. So if the amount of protein or the albumin goes
Great
down, okay,
sugar.
you can get edema. Okay, if you get edema, your blood pressure can go down. There's not enough water. Your kidneys can get damaged. Okay. On another one is bilirubin. So if your liver gets damaged, bilirubin will increase. You'll develop jaundice. Okay. What else? There are a lot, actually. There are a lot. So inflammation in the liver. So basically, the liver's main function is to detoxify the body. If it gets damaged, that the capacity of the liver to detoxify will decrease. But for that to happen, you have to, your liver has to get damaged substantially. Okay. So, mhm. Yeah, there you
Thank
have
you,
it.
Doc.
Okay. Yeah.
Thank you, Dr. Jansen. All right. Well, actually, that's our last question for tonight. But for those of you who still have a question or questions, you can definitely send us a message and we'll get in touch with you individually after the program. So just before we say goodbye to our viewers, I'd like to ask for a very quick parting words from the both of you, starting off with perhaps with Sir Shyan.
I'm just glad to have Dr. Johnson back and to all our
Yes.
viewers. Okay, this is what we actually do regularly. We've been doing it for 2.5 years, 3 years. So every Thursday night, we are here to answer your questions. And the more lively your questions are, the more interesting our conversations are too, our discussions are too. So we really welcome you. Next week, we're going to talk about a cancer that is very close to everybody's heart because it's one of the most common cancers. And that is, we're going to talk about breast cancer. So I would like to invite everyone so that we can have a lively conversation. And we are very happy to answer specific questions. Many patients actually ask very, very specific questions, like they're HER2 breast cancer patient and they're taking this particular drug. What does that mean? We're very happy to answer all these questions, and we hope we and do our best to serve you in that area. So looking forward, please join us every Thursday, share with your friends so that they can ask questions and get answers. Doc?
Thank you, Sir Shyan. Doc?
Yeah, so that's right, no? So next week we're gonna have a very interesting discussion. So I'm gonna tell you the story of one of my patients. This is a stage 2 breast cancer patient, no? Right now she's in remission. So we're gonna discuss how she did it. Okay, you're gonna learn what she did. Okay, what
Wow, that's
she
interesting.
not do as well.
That's
Okay,
exciting.
so yeah, next week please stay tuned. We're gonna go an in-depth discussion on her story and some of the things she did. Some explanation of why she did that. Okay, some certain procedures that her doctors did, no? An explanation of her laboratory results. We're gonna do all that. Okay. So tune in next week. So see you guys.
Thank you, Dr. Jansen. Thank you, Sir Shyan. There you go. I am very pleased that we have once again got honest answers from your questions. And of course, once again, just to reiterate, next week, that's 7:30, May 11th, Thursday. The topic is entitled Breast Cancer from Awareness to Action. There you go. So it's a very interesting topic. We hope that you can also invite your fellow patients in your hospitals and your clinics to join us next week. And of course, please get ready. I'm sure that you are all excited because tomorrow is 5/5, or we have the mega sale 5/5 in our Lazada. So please take a look at our check out our participating products in our Lazada. We are not only in Lazada, but we are in Last Mall. There you go. So once again, thank you so much for joining us, and we really hope to see you once again in our next webinars to come, because here in Simply Nature, we are always with you from start to healing. Thank you, everybody. Good night, and God bless you.